Brilliant. Welcome everyone to this County Lines How to Spot the Signs and Keep Children Safe event. Great to see so many supporters of Unseen attending and to welcome new supporters too. I'm Justine Carter and I'm going to be chairing the event today. We do run events like this quite regularly, and we've found them a great way to share our knowledge and to learn from other experts in the field. So really thanks to you all for finding the time to engage with this really critical issue of county lines. I just want to run through a bit of housekeeping first. So the event is being recorded. Please email us if this is an issue. We do have a Q&A feature, which you'll see in the chat. So I'd encourage you to ask any questions that you might have as we move through. We do have time after the panel discussion to address these questions. You can also like other people's questions if you're keen for us to ask that to the panel. If your question isn't answered, you're welcome to email fundraising@unseenuk.org after the event, and we will do our best to answer it as best we can. I do encourage you to introduce yourself in the chat and tell us why you're here today. It's always good to see who's managed to turn up to these events. Just on to some quick introductions. My name's Justine Carter. I'm a Deputy CEO for Unseen, and I led the development of the 2015 Modern Slavery Act and set up the Modern Slavery and Exploitation Helpline, which you'll hear more about today. We've got Alice Dutton on the call. She is our Quality and Development Manager at Unseen's Modern Slavery and Exploitation Helpline. Alice has worked for the Helpline for over 4 years, so has got lots of knowledge and understanding, training our expert Helpline advisors to support survivors and those in contact with them, and to help them understand that they do have a range of support options. We also have Nick Meller, who is a team manager for Link's team, Devon County Council Specialist Service, which works to reduce risk and harm to children and young people. So we'll hear from Nick in a moment. And then finally, we have Natasha Mitra. She's Unseen's Head of Helpline Services. And Natasha oversees the Modern Slavery and Exploitation Helpline, a vital service that provides support to potential victims of slavery, including those caught up in county lines. But before we launch into the questions, I just want to let you know that today, the 12th of June, marks World Against Child Labour, and as well as the launch of Unseen's County Lines Appeal, which will run until the 24th of July. Donations to this appeal will go towards our Modern Slavery and Exploitation Helpline, and this free confidential service is essential in helping those in county lines find safety. Our expert helpline advisors deliver support to potential victims at a crucial part of their journey. A gift of just £15 helps support for a child experiencing exploitation. We'll be providing the appeal donation in the chat so that you can find the link there. So in terms of our panel, welcome to the panel. We are going to run through a number of questions with the panel just to hear from them, their perspective around the issue of child exploitation and county lines in particular. So the first question is for Tasha, our Modern Slavery and Exploitation Helpline head. So Tash, can you just explain to us what county lines really is?
Yeah, so when we're talking about county lines, we're referring to movement of drugs, usually from urban to rural areas, and it's commonly children and young people, as well as vulnerable adults, that are exploited to package, transport and sell drugs across the country. I think it's also worth mentioning that cuckooing can also take place, which is where a vulnerable person's home is taken over and then used as a base for that kind of activity.
Fab, thank you very much. And I think obviously county lines is one of those issues that I'm sure many people have heard about. But in terms of who can be affected by county lines, Alice, what are some of the misconceptions that the public have about children who are specifically involved in county lines?
Yeah, great question. I think it's always one of the risks, isn't it? Like, you talk about awareness raising and you raise awareness that specific types of people can be targeted, and obviously they are. But one of the really important things to also remember is actually that it can impact anyone. As Tasha mentioned, commonly something that affects children and young people, but we also see numbers of vulnerable adults who are targeted for the same type of exploitation. And with cuckooing, that's often adults because it's targeting a home base, and adults are more likely to have their own home base to be targeted. And really, it can affect anyone, and exploiters will try and find something that they can use as leverage over the person that they're targeting. So it can impact anyone of any gender, any ethnicity, age, socio-economic background. And something we also commonly hear about is the targeting of people with substance abuse issues. So already got that contact with drug dealers, people selling drugs, and also the targeting of people with learning difficulties, and obviously using that as a way to target and then control them. And something we often hear about is those who are isolated and lacking a support network. One of the things when you're looking at grooming is knowing that exploiters or perpetrators will expend a large amount of time on identifying and targeting individuals to groom them into exploitation. And they'll often work to identify some form of unmet need in a person's life. And that can be really varied depending on who that person is and what their background is. It could be like an unmet financial need. It could be someone who's living in poverty or their family are living in poverty, and that makes them a target for the exploiter. But it could also be like a relational need. So someone who's feeling really isolated, someone who doesn't have many friends, maybe doesn't have a stable parental figure. They've got that like unmet relational need. And then when you've got someone who comes along pretending to be their friend or acting as this kind of older role model for them, they're really able to gain that person's trust and then use it as that method of control in grooming, which is really sad when you think about the kind of the ways that they're able to target that. And the perpetrators, like, they really do spend time sort of meeting that person and actually like becoming their friend or becoming that relationship in whatever form, to the point when actually this person who ends up being exploited will often like think it is their friend, think that like they're doing this for the greater good, or like they really want to help me. And it's really sad when you think of it in that context. And that's why it can affect anyone, because most people have something in their life that's a need.
Absolutely. And I think what you've highlighted there is just the kind of range of vulnerabilities that we see through the targeting of particularly young people within a county lines perspective. And I suppose the world's changing, and we saw lots of activity happening throughout COVID. So I'll just turn to Nick and ask Nick, how has COVID, for example, changed the landscape of county lines and child exploitation from your perspective?
Hi there. Thank you, Justine. Significantly, I think what we saw, so I can talk on behalf of what we saw in Devon and across the southwest, was the models of county lines changed significantly because of the impact of the pandemic, because people were inside. So what we saw, there was different strands, but one of the strands that we saw was about the movement of drugs. So the supply models and networks changed. So what we would have typically seen with the county lines model is the use of sort of things like public transport and people moving drugs down, or what we began to see was the use more of private vehicles, so that they were more difficult to trace. And what we began to see as well was the kind of exploitation of children that were living locally, or young adults within. So for us, like, the biggest city is Exeter. So the people that were living in that city centre, because it took away I suppose, if you have someone living from another part of the country that moves into a city or wherever a town, they will typically stand out. So what the exploiter started to do, what the gang started to do, was to use local people that were vulnerable. We saw a kind of change in the way social media was used, and platforms like Instagram, particularly, and Snapchat we use quite a lot for coordinating the sort of supply of drugs. And that's something that was kind of spoken about earlier by Tash, was about cuckooing of addresses as well. So we saw a bit of a rise on that, and that was something that was recorded by Devon and Cornwall Police. We have meetings in Devon called Maces, which you'll probably have up and down the country, which are exploitation forums, where we kind of have professionals together that kind of talk about young people and adults where there are concerns around exploitation. And we saw a marked increase in kind of reports of cuckooing. The sort of exploitation of vulnerable groups changed quite significantly. The exploiters started to target the types of people that we wouldn't typically see. It wasn't just we would stereotype and say it would always be children that are care experienced, children that are in the care system. We started to see young people being exploited from middle class affluent backgrounds as well. Children that had presenting mental health issues, or perhaps there was a bit of drug use and they were moving in networks with other young people and they were being exploited. They didn't realise it was going to happen. The other thing that we saw as well was recruitment of parents, and that was really concerning. So we began to see coercion of parents by the exploiters, and those parents being quite fearful, so they were at risk of intimidation. And we actually had examples of where we had parents that were taking their child to deal drugs in cars, and that worked really well for the D list because it would not be something that would be picked up by the police. And we learnt about that really through those children themselves reporting that they were living in fear, and the parent was actually facilitating them in that kind of supply of drug dealing, I suppose. The other thing that we saw as well, and quite a big impact on police or on COVID, was about policing and safeguarding. The pandemic kept everything really quiet, and it was very difficult from a police intelligence perspective to actually identify who some of the children were. And we saw, so my background is from a social work background originally. I've worked in the kind of field of exploitation for about 10 years, but we saw a real marked decline in the number of referrals, inquiries that were coming into children's services around children that were being exploited because everything went silent. And that didn't mean anything at all. It just meant that people were being quite careful in the way that they worked. And just going back to the stuff around social media, there was the emergence of apps of things like Telegram, which was particularly useful because it's encrypted. It doesn't work in quite the same way that things like WhatsApp work. So people could send messages that would be encrypted and then disappear. And that, from a policing public protection perspective, made it very difficult to actually identify those risks. Yeah, they were the kind of headlines, I suppose.
Yeah, great. Thanks, Nick. I think what's really interesting is that obviously through the pandemic, it was unusual to see people on the streets. So that move, as you said, to using platforms, social media, for example, and I think what that highlights is the challenge around the adeptness of these groups to change their modus operandi when they need to, and the police needing to stay alive, and also the safeguarding services needing to stay alive to the changing MO that is used by these criminal groups. And I think also what we've seen as well is that assumption around young people being in quite challenging backgrounds, that move to more affluent backgrounds, because we often see children, as you said, who are looked after in the care sector or have been excluded from school, being at significant risk. But in terms of being out in the open, because we see a lot of the county lines movement and the activity is clearly out in the open, I'll turn to Tash now and say, from your perspective, what can people do if they're worried about county lines exploitation? What would you say to anybody that saw this on their high street?
Yeah, I think first of all, before it's been observed, I'd say just make sure you're aware of the indicators to look out for. So knowing what's normal for your child or family member, or for your students, your clients, whoever it is, if you're a professional, have professional curiosity, ask questions, seek out training wherever you can. But then also talk to children about healthy relationships in all forms. So whether that's with their peers, romantic relationships, older children, adults, give them the tools to know how they should be treated and the red flags to look out for. So definitely document all your concerns. Any instances of a child going missing for any length of time should be reported to the police or local authority to build that picture. A trained professional conduct a return home interview. I'd say it's really important to take a multi-agency approach. So it's not something to be tackled in isolation. Engage with the school or college, engage with the local authority. Don't be afraid to advocate for your child. And obviously reach out to specialist organisations to access support for your child and for yourself as well. Obviously, if you need help on how to advocate for a child, you can contact the Modern Slavery and Exploitation Helpline. So we can go into a lot more detail than we can in this webinar around the support options and disruption and prevention tools that statutory agencies can use to stop county lines and protect victims. We can help you understand the jargon and help give you the language and understanding to effectively advocate for your child or family member.
Yeah, great. And I think what you've highlighted there is that taking a multi-agency approach is absolutely vital. One of the other areas is around really listening to the young person and not making judgments. So I've been involved in situations with policing where judgments have been made about a young person, about their lifestyle or assumptions, and therefore we then overlook their vulnerabilities, and I think that's why a multi-agency approach is very much needed. And I think not forgetting that victims do present in very different ways, and there is no atypical victim, and we need to remember that when we're engaging with them. Thinking about the signs that we're looking for. If I come to you, Nick, what signs should schools in particular and families or communities be looking out for to really identify the children that we believe are at risk?
So I'll go through, I made a list, but I think the caveat I'd say for any of this is that any of these signs don't necessarily mean a child is being exploited, and equally, they could do. So I think it's always just having that in mind. I think the first thing I'd say is they're always going to be varied, and as has been picked up by Tasha already, is you're in roles where you know those children and you know them best, parents know them best, and those subtle changes or perhaps significant changes could be a key in themselves. So I think notable changes in behaviour, so if a young person, child was becoming a bit more withdrawn, perhaps secretive, that may be a telltale sign. If perhaps there's a change in substance use, if they weren't using substances before, that could be indicative of something. Equally, perhaps changes in their presentation around their mental health, low mood, perhaps even more extreme and sort of suicidal ideation. The things that may be offered is actual changes in appearance. Has their clothing changed? Are they wearing particularly branded items? Because sometimes we see when we've got particularly young males, but not in all cases, that kind of get into that sort of drug dealing lifestyle. If they begin to make money, then they'll go with a set identity because it fits that sort of stereotype. If they're wearing changes in clothing, designer clothing, jewelry, it could mean something. And if that parent or professional saying, well, where have you got the money from, and that young person isn't able to tell you, then remain professionally curious. Unexplained injuries, cuts, bruises, black eyes, that could be because of that person is involved in something and perhaps they're under threat and intimidation. So it's being professionally curious again. We know from the big inquiries of children that were victims of sexual exploitation, which we're not talking about today, but back in places like Rotherham and Rochdale, one of the key findings from them was about the lack of professional curiosity and people not asking those, mainly girls, questions about, are you okay? So the relationship is anything. So if you take anything from this, is the relationships you have with those children are the biggest protective factor that we've got. Ask the questions, don't be shy, and even ask questions that may seem, do I even need to ask that question? If you don't ask it, you don't know. And we can get other styles. You might see changes in language, slang words, new words coming into someone's vocabulary that could be part of that person's kind of group identity. Missing has been spoken about before, and missing and hidden missing, they're quite different, but missing episodes that aren't being reported to the police within what's going on with that young person's family environment. Perhaps they're not going into school, perhaps their behaviour is changing in school, and we're starting to see a pattern of exclusions leading them maybe to being PECs, like permanently excluded. Is like my bugbear of children being permanently excluded from school. I think it should ever happen, but that's just me. And perhaps children spending nights in, I'm in a hotel for the night, use of budget hotels. They're often linked again more with sort of forms of sexual exploitation, but they can be used by people that have been criminally exploited, because if you've got addresses that you can go to, where those hotels where you don't have to provide any ID and you can just tap in and go, they're quite helpful places to be having drugs there for the night and going out and supplying within the local community. They're very cheap to stay in. Other typical things as well are about mobile phones, extra SIMs, burner phones, and perhaps carrying weapons. You might see that if a person is fearful or is expected to be carrying and they've not done that before, then that would typically be a bit of a telltale sign.
Yeah, great. I think you've covered quite a lot there. Sometimes it sounds quite elaborate in terms of, they might have additional burner phones, and we hear about that in movies, but this is the reality of what we're talking about. I love that professional curiosity. I think that's so key, being vigilant. And I fully agree around permanent exclusion and the additional vulnerability that creates for a young person. But I think what you've also highlighted is around having new clothes or new items that they might not have had previously. But I think what we've seen as well is just simply being offered and taking an offer of fast food, for example, can make that connection with an individual who's intending to exploit you. I've given you something for free, so you need to give me something back. So again, it can be that simple. And I think it's absolutely crucial what you said, not jumping to conclusions. Speaking to the school or youth services or any other organisations that the young person's involved in can really help you to understand whether there has been a change, why that change is, and how you can maybe navigate that. And I think what you said about sexual exploitation, I think is really relevant though, because none of these types of exploitations that we talk about are mutually exclusive. So we do see individuals in situations where they're being exploited in more than one situation, more than one scenario. So it's really important to think about that. So I'm just going to come to you, Alice. So in terms of all of that and thinking about all of that, how does Unseen work with potential victims of county lines exploitation?
Yeah, of course. I think the first thing I'd say is that it's really important to take a person-centred and trauma-informed approach. Really important for us at the Helpline that we're creating that safe space for people to talk about their experiences and really to help them feel believed. County lines criminal exploitation is so incredibly complex, and it's like an overlapping web of crimes and exploitation and trauma. And what we found in our experience of working with survivors is that many people will tell us that we were the first organisation who they'd ever felt they could tell and who'd ever believed them. And that's something that we don't take lightly. That is incredibly important for us, that we're recognising that these are people who have faced, as I said, such complex and overlapping trauma and crimes that all intersect within criminal exploitation. And unfortunately, something we still see to a huge extent is that survivors of criminal exploitation are often unfairly seen as the criminals themselves. We in this room all know that's not true. And when you look at the extent, as I was saying, about the amount of time that goes into grooming them, and when we look at the methods of control that exist in that conversation, when we think about the fact that we're largely talking about children and we're talking about incredibly vulnerable adults, you would think that anyone would be able to look at that and say, this person is not the criminal here. This is someone who needs our help. We're the professionals here. We're the police, or from whatever organisation. We have a duty to protect these people. So really important, as I said, that trauma-informed approach. In terms of contacting the helpline, we're going to be trying to make an assessment and understand, like, from them or from the person who's in contact with them, because lots of our contact is from third parties. What is it that's happened in that situation? Lots of people, although there's a greater awareness of county lines, lots of people don't actually realise that it is a form of trafficking. So it's human trafficking. So it's covered under the Modern Slavery Act, and there is support and there are protections available under that. So really talking to them about that useful information, about those support options. If we're talking, it's like a third party, someone who's contacting us concerned about their child or their friend or a student, really just giving them the toolkit to be able to have those conversations, to know what support is available. As like a professional dealing with children, you have to know so many types of things, and we can help. We know about this, we can help with this. So just giving them that advice on what it is that they can do, that multi-agency approach that Tasha was talking about. But also, like, with the best will in the world, sometimes when you have a conversation with something, you accidentally say it in a way that you probably didn't mean. So like I think one of the best examples of it is, why didn't you leave? Like, on the face of it, it's quite a helpful question, because why didn't they? Something was controlling them. But what we know from working with survivors is that actually that casts quite a lot of blame. So we can also work to just identify with the language of modern slavery, but also how to use that language in a way that's most likely to get a response from someone experiencing this, who actually feels that they can open up about the situation. When we're working with adults, it's really important to be specific about what their needs are and what their wishes are in the situation, as someone else intervening against their wishes with the best will in the world could actually be incredibly harmful. So it's really important to just take that person-centered approach. And obviously that applies with children as well, like talking about them, their understanding of the situation, what their needs are, what safety looks like for them. Always with children, there are those overarching safeguarding risks that need to be considered because they are a child at the end of the day. So that means that on the helpline as well, we do have different processes when it comes to reports involving children. And I will say that one of our exceptions to confidentiality is when we think there's risk of harm to a child.
Fab, yeah. I think having said safe space is so crucial, we can't overstate that at all. And I think for me, the independent nature of the helpline really helps to create that safe space. And you quite rightly pointed out that language is so important and it really leaves a lasting impression. So we should all be very cognizant of what we say and how we say it, particularly to a young person. So just turning to Nick, because I think we often think this is adults manipulating and coercing younger people, but can you just explain to me, Nick, a bit about peer-on-peer exploitation and how we might be able to spot the signs of that?
Yeah, it's a really good question because it's probably an area of exploitation that we see the most, and it's often not detected. So in essence, it's exactly the same model of children being exploited, but instead of being exploited by an adult or stereotype, they're exploited by another peer. And that's quite a convenient model for, say, a wider group or gang, because if you've got someone within that group of similar age, then it's easier to have that forming relationship. The complexity of it is, though, is although it's exactly the same process where you've got a friendship and then that friendship evolves into something that then becomes where there's coercion, control, usually some kind of form of debt bondage, whether it's via drugs or money or giving you a burger, you need to give me something back. There's a real sense of shame for those children that are the victims because it's confusing, because typically they start the relationship with that person as it's a friendship. They see it as nothing beyond that, as this is my mate. When we see young people that have actually been groomed by another peer and resulting in them being exploited, they feel really embarrassed. They don't talk about it because it's a conflicting thing of, I was friends with this person, but now I find myself in this situation. That kind of supports the hypothesis. We don't get many young people that will make disclosures where we get referrals into we call it our front door in Devon. Often they're called MASHs, like safeguarding hubs, of a child saying, I've been exploited by another child. It's very rare. We find it out we have lots of meetings where we meet with police and other organisations where you learn about these sort of groups of young people, and then there'll be a particular a ringleader within that group that draws people in. So I think what we'd say is the model of operation is no different to any other form of exploitation, as in the difference is that you've got people of similar ages, we get fewer people actually disclosing, and you've got that sort of sense of shame. And then how you would identify that young person has been groomed by another young person are again similar to all the things I spoke about a bit earlier about we might see change in behaviour, they could be going missing more, substance use, them being a bit more secretive and injuries and all those types of things. But it's very difficult to identify. And I would again say the thing that I would encourage your colleagues to do on the kind of phone line or whatever is actually explore the nature of those friendships and actually, are they healthy, are they not? Because what we often find with young people at our service support is what they accept as a healthy friendship. Many of us would just think they think that it's okay for their mate sometimes to assault them, and they'll just say it was banter, it was this, it was that, and things get accepted. And then we know with kind of stuff around the grooming line, the way those things work is that when those behaviours become normalised, they're contextualised, then there's a degree of acceptance. And then it's quite easy for a young person to be drawn in, okay, we use some drugs, why don't we just give some drugs to our mate because he's down the road? And they're gently coerced into that sort of model of dealing drugs on behalf of somebody, or, oh, I'm going down here, do you want to be in the car with me just to keep me company? And they're not really understanding what's actually happening. One thing I want to touch on, and I don't want to go too off piece, but it's a really relevant point. And the crux for us in our work, children's services, is about the adultification of children. And some of you might be familiar with that term that covers many things, but it's about children not being seen as children, they're being seen as adults, and particularly children from different ethnic backgrounds that are profiled very differently and accelerated into the criminal justice system wrongly. And I think the difficulty we have in our area of work always is that there are two different sort of expectations. There is the safeguarding side, which I very much sit on, which is about we're working with children, and they're children, even when they're 18, they're legally adults. But I think back to when I was 18, I wasn't an adult. I thought I was, but I wasn't. I didn't behave like one. There's the views of the public at large that often there's a public protection. We want things done. And when we read in some of our social media outlets online or certain newspapers that want things done to children that have been bad, you've got these two very opposing kind of schools of thought of what do we do. And in the middle, we've got a child. And I think that's what we always bring back to. We've got a child that's a victim, that's been exploited. And whatever happens within the criminal justice system is not going to resolve these issues. And in some circumstances has a rightful place. But actually, we need to be protecting these children and safeguarding them.
Absolutely. I think to bring to life, they're not receiving many disclosures from young people, and just that being quite evident, that assumption that the young person's committed a crime and therefore they should be treated like a criminal, notwithstanding that they're a very vulnerable young person who is also a victim in their own right. Tash, what is the relationship between you and the police when it comes to tackling child exploitation from a helpline perspective?
At the Helpline, we have a really collaborative approach, and we work with quite a wide range of different partner agencies to tackle modern slavery in all forms, including child exploitation. We're regularly referring information to the police to aid investigation. As we're an independent service, people often feel more able to speak to us than a statutory agency directly, so we can help bridge that gap. We also refer potential victims of exploitation to police and other statutory and non-statutory bodies to advocate for them to receive support from the government's modern slavery and human trafficking specific support system known as the National Referral Mechanism. As an independent organisation, we have a do no harm approach. It's one of our fundamental principles, and we always want to risk assess any information shared with external agencies, making sure it's in line with the survivor's wishes wherever possible, and it doesn't cause that greater risk of harm to them or anyone else. So we have really robust internal processes to ensure that information shared adheres to our confidentiality and person-centred protocols. We also act as a resource for the police and other professionals. So if they need advice and guidance around how to support a potential victim or what their statutory duties are, we can do that. I think, unfortunately, across the UK, there are discrepancies in the level of training provision for statutory agencies. So some people haven't had modern slavery specific training or understand how to enter somebody into the National Referral Mechanism. So we can support them with that and offer guidance and advice around how they can best support survivors.
I really want to get to some of the Q&A that we've had through. I'm just going to ask you, Nick, quickly, is there enough collaboration between social services, schools, the NHS and the police in tackling child exploitation? And if not, what do you think's missing?
I think I can only comment on Devon. I think nationally it's really varied. In Devon, we've got the service I manage, which is a risk outside the home service. So we're like the specialist service that are working with those children that are going missing at risk of forms of exploitation. There generally is good partnership working. So our service sits under the umbrella of children's services within Devon, and we liaise really closely with children's services teams across Devon. We work really closely with the police. We speak to the police daily about children that are going missing. We have a daily briefing with any children that are missing. We have monthly MACE meetings that I mentioned earlier. There is a partnership approach, and I think practice has certainly evolved in the 10 years I've been in this work, leaps and bounds. That said, there are still gaps, and I think Devon is not in a unique place here. I think the sort of stuff about adolescent risk, statutory agents will tend to focus more on younger children. So for social workers, it's very easy to have a safeguarding response to a baby or a toddler because it's easy to spot. It's easy to spot neglect. It's easy to spot. Where we're looking at risk with adolescents, it's much harder, and sometimes the law is quite blunt. So legally we accept children are children up until their end of their 17th birthday, and beyond that, then they can choose to do whatever they want to do. And that isn't always particularly helpful. And children's services roles, well, children's services can get involved with a young person up to the age of 18. Often, I think the conversations that we would have with colleagues in our social work teams a few years ago was they're a teenager, they're making a choice, and we would be saying they're a child and they're at risk. So the narrative, the conversation has really changed so that we're seeing teenagers as children, whilst obviously allowing them to be teenagers and advocating for them. It's seeing risk differently. We work in Devon, and again, Devon's not unique here. There are lots of statutory children's services process. So some of you might be familiar with terms like sort of children and child protection registers and child in need, or in Devon we have similar. So we have those for younger children, but we also have things called, we call them Safe for Me. So it's adolescents at risk. So they'll be like subject to the child in need plan. So we have Safe for Me plus, children that are where we've got real significant child protection concerns, and they're managed under that sort of statutory label legally, but we badge it differently. So we see the risk is specific to that risk outside the home. So practice nationally has come on leaps and bounds, and there's organisations, particularly like things like yourselves, the Contextual Safeguarding Network, they've done loads and loads of work around adolescent risk and criminal exploitation and stuff. So it's good news. Things have improved significantly, but there are still gaps.
Yeah, absolutely. And I think, as you've quite rightly mentioned, given we've got 40 odd police forces across the UK, that the response can obviously be different in different areas. I'm just conscious of time, and we've got a couple of questions in the chat. One from Karen Joseph: is there a place to see up-to-date stats in each local area? For example, I'm in the Plymouth area. Tash, I know we were going to talk a little bit about what we see on the helpline in terms of numbers, but maybe you could answer that quickly, and we'll plan to give some statistical information off the back of the event today to participants.
Yeah, absolutely. We capture a lot of structured data as well as our case notes. So we're able to provide kind of anonymized aggregate data insights. So we've recently put out our annual assessment, which you can find online. I'll put a link to it in the chat, which is a breakdown by exploitation type, by demographic for each police force region in the UK. There's quite a lot of other statistics around criminal exploitation and exploitation of minors as well, which you might find interesting.
Great, thank you. And I think an interesting question about seeing young people involved in dealing and taking a broader range of drugs due to online marketplaces rather than the traditional kind of supply crack cocaine and heroin. Nick, have you seen anything from your perspective that suggests that might have changed? And from my conversations with policing, there has been evidence lower level drugs as much as amphetamines also being traded from a county lines perspective, but clearly crack cocaine is one of the key drugs that we see.
Yeah, crack cocaine and then things like heroin. What we're seeing in Devon is a real influx and use of ketamine. It's by far like the drug that is just being, whether it's by organised through like county lines, but certainly just among reporting, we've got a young person's drug service in Devon, and the sort of data we get from them and just young people reporting is ketamine use is rife.
Yeah. Thank you for that. I think given that we've only got a couple of minutes left, I'd like to turn to Alice. And in the last couple of minutes, Alice, can you give us some examples of situations where the helpline supported someone in a county line situation? Because I think it's always really helpful to bring to life what we're actually seeing. If we could just say in a couple of minutes.
And as Nick said, you've got a child that we're talking about at the end of the day. One of the examples that springs to mind for me was when the helpline was contacted by a young man. At the point he contacted us, he was an adult. But what was really missed in the identification of his needs by the criminal justice system was that this all started when he was a child, and you just really had that barrier to identification there. When he contacted us, we were able to have that conversation with him and figure out what had been going on and just really draw out all of those grooming techniques. Like, it was textbook. He didn't have many friendships, didn't really have that sense of belonging. His family were actually living in like financial insecurity. And suddenly this like older guy comes along, befriends him, giving him that like friendship, identifies that financial need. And it's, oh, actually, I've got a way that you can start earning money. Like, just textbook grooming. But obviously when you're a child and you don't know about that, and you don't know about those healthy relationships as we've spoken about, you don't realise that. And we were just really grateful that actually his solicitor helped him to get in contact with us. He was at this point being charged with drug offences. And we were able to take one look at that and just be like, this is someone who was a victim. This is someone who has survived like horrific violence after he was arrested and his perpetrators found out. Like, this is someone that we should all be coming together to support. And what public interest is there in prosecuting this man? Like, he's not the kingpin. He's not the one gaining from this. So we're really grateful that his solicitor actually was able to put him in touch with us, and we were able to have that conversation. Again, just really believe him and help him understand the language of what had happened to him. We were able to speak about the fact that there might actually be support options available for him, but also under the Modern Slavery Act, there is a defence that if you were forced to commit a crime as a result of your exploitation, that you can use that as your defence because you were forced. You didn't have a choice over that. So we were able to just make him and his solicitor aware of the support options available for him. And that was a really positive one for us, just really positive that we could have that conversation and believe him and he felt he could speak to us. And then even better on that one, we actually found out later, we got an update and they said that it had been passed to the relevant policing team who hadn't previously been aware, the child exploitation team, and they were taking the action on that one. So that was a great day on the helpline when we found that out.
Yeah, no, and I know that's just one of so many cases and situations that we could talk about, but thank you for that, because I think it really does help us genuinely understand what's happening and how people can speak to the helpline and get some help and support that they need. We've run out of time. Thanks so much everyone for joining us today. It is so important that we take time to understand issues like this. We do need to work together collectively to combat this issue, and I really hope that you've found the event interesting and have some insights to take away that can help inform your knowledge and understanding of the issue. Thanks also to our 3 esteemed panellists for sharing their insights and their understanding. And finally, just to remind you of Unseen's County Lines Appeal, which will run until the 20th of July. Donations to the appeal will go towards our helpline, which is essential in helping those in county lines exploitation find the safety they need. We are extremely grateful to all of you for your support and your help with Unseen and supporting those who are trapped. Thank you so much for your time. Thank you.